the inside out. This is episode 1 for Friday, March 1st, 2013.
That's right. And in today's episode of Cosmetic Networks Live, it's the first of what we hope will be many exploring the world of cosmetic and aesthetic practice, science, business, and consumer experience.
Today, we would like to welcome to you Dr. Michael Nicoli from Newport Beach, Orange County. Hi, Dr. Nicoli.
Hello, group.
Welcome.
Thank you very much for having me.
Dr. Nicoli has founded is the medical director of CosmeticCare Plastic Surgery Center and Med Spa in Newport Beach. He's also established a charity called the Magic Mirror Foundation, and he has dedicated decades of his life traveling around the world, helping other people in third world countries. And wow, that's quite an accomplishment, Dr. Nicoli.
Thank you.
That's fantastic. Before we get to talk to Dr. Nicoli, we want to take a couple of minutes to take a look at some of the stories in the news for today. And the first one, a new breast implant called the Natrel 410, highly cohesive, anatomically shaped silicone gel-filled breast implant. It was approved. They're manufactured by Allergan, and 7 years of data were gathered and analyzed from 941 females before the FDA made their decision to approve the implant for augmentation and reconstruction. And in other news, according to EIN News, tummy tucks may help with weight loss, says a group of New York City plastic surgeons. A recent study has drawn connections between tummy tuck surgery and weight loss, according to the Cosmetic Associates of New York. According to the study, a procedure known as the abdominoplasty, also known as a tummy tuck, may result in long-term weight loss. Researchers evaluated women who had undergone a tummy tuck, gauging their results 1 year after their procedures. 14 of the 20 study participants had lost an amount of weight greater than that of the tissue removed by their surgery. And finally, the beauty obsession feeding Iran's voracious cosmetic surgery industry is reported on by The Guardian. Apparently, Iran has the highest rate of nose surgery in the world. According to a report in the conservative Etimad newspaper, as many as 200,000 Iranians, mostly women, go to cosmetic surgeons each year to reduce the size of their nose and make the tip point upwards.
Wow, there's 3 top news items. Dr. Nicoli, is there one you want to start with to make a comment on?
Well, I'd probably like to speak on each one of them because they're significant and educational to the public. First is the Iranians. They accept plastic surgery. You know, there's no question that entire society accepts it. Now, I'm an Italian descent. You know, we have larger noses. The Iranians have larger noses. They come to an American culture and they see, you know, Hollywood, and they see beautiful noses, and they want smaller noses. So it's way more accepted. It's just like Argentina. You see people all over the streets. This is 15, 20 years ago when I used to go down here. Everybody, it was accepted. Insurance companies paid for it even in Argentina. So it's much more acceptable. But when you look at the entire world with the internet capabilities today, it's being accepted everywhere. I mean, I go to lectures all the time, and there's surgeons from all over the world, and they are talking about the volume of their increased volume of cosmetic procedures done. So it's being more accepted.
We're hearing that. That's pretty exciting.
Yeah. So
So the tummy tuck, what about that?
On the tummy tuck. Now, we know darn well that when we motivate patients, you get a patient that's gone on by a lap band, or you see a mommy makeover patient that comes in your office and she's overweight, she can't get rid of her tummy, it's really a lot of stretch marks, it's not attractive to her. And so they come in the office, they're a little overweight, you do a tummy tuck on them, you remove anywhere from 3 to 10 pounds, and absolutely they go crazy. They start looking at themselves, they start going on diets, they start exercising. So it's a motivating factor that if they could have done 100 sit-ups and not got rid of their loose tummy and stretch marks, but once we do a tummy tuck on them, only remove 4 or 5 pounds, and some of the heavy patients we've removed 25 pounds. but nevertheless, it motivates those people into even looking better and better and better, and so they do lose weight. They do get on an exercise program.
So, Dr. Nicoli, what I hear a lot, when we talk about these stories, there's obviously a huge emotional component to the decisions that go into having these types of procedures, and then, of course, recovering. Can you talk to us a little bit about your experience with patients in terms of the experience that they have emotionally, both in preparing for making the decision to finally have a procedure, and then during the recovery phase as well?
Yeah, it's a big decision. Any kind of surgery has risks, from anything from scarring to death. So you get these patients that are extremely motivated because they've had their 4 kids, they've lost, some of them 100 pounds, 120 pounds, and now they look at their bodies and they look terrible because their skin is hanging down to their knees. And so how motivated they are, you have to play psychiatrist along with being a plastic surgeon, and you have to look at these patients and make sure they're great candidates. The majority of them are human, they're great, they understand. As long as you have a good rapport. My whole staff have been trained and trained and trained on how to take care of the patients and find little red marks that say, oh, this patient's upset or this patient's not doing well, and we attack that problem immediately. So it's a whole team approach that we use at our facility, and we got great results. Our patients, I mean, I've been in practice 25 years, so the majority of my practice is referral. So many of these patients are referring their girlfriends that want mommy makeovers, or the bariatric type patient that's lost, anywhere from 25 to 150 pounds, are excited because they come in and there's a team of people and players that are going to support them through this whole experience.
Yeah,
terrific. Do you consider, obviously it sounds like you're really playing the part of not only surgeon but also psychologist. When you, in your practice, do you consider what you do more of a science than an art, a blend of the two? How do you approach it personally?
I think it's a little bit of everything. I mean, you have to be, some of the younger people, you're a father. Some of the older people, you're a brother. So I mean, you can't individualize. I take each patient as a family member, and I sit there and analyze them. Are they going to be able to handle this major type of surgery? Are they going to freak out and not accept it? So many times we do facelifts and change the body and change the face. Are they going to be able to handle that? So you have to sit there and analyze that patient and make sure it's going to be a positive thing for them. There are a lot of
how long a process is that? I mean, do you spend a few hours with the patient beforehand, days? Is it, in your experience, what type of process is that?
Most of the patients today, because of the internet, and they come in the office and they know what they want. They've seen other surgeons. They've done tons of research. It's amazing. Today, compared to 25 years ago, they're a much more educated patient load. So I could spend anywhere from 5 minutes to a half hour over, reviewing what their concerns are. And now, don't forget, my staff has also seen these patients and have spent another half hour. So they get educated pretty much impeccably today.
Dr. Nicoli, as big of a surgery as a tummy tuck or even a mommy makeover is there an age limit of how old someone, if they're old is too old, or how young is too young to?
I see patients that are 40 years old that are too old, health-wise. I see patients that I did, when we were on Barbara Walters, for instance, we saw that patient that I did last year. She was 85 years old, and we did a breast lift and a breast implant. Was she too old? Well, she was in Hawaii 2 weeks later strutting on the beach. So I don't think you can generalize or categorize that anybody over 50 shouldn't have surgery. If they're a certain age, they're active, they're in the community, and they want to look better, then you have to look at it. You have to get a very thorough and good workup by a great cardiologist and an internist to make sure they can undergo a 3 or 4 hour operation. But once everything is cleared and they're capable of having this surgery on a health basis, then I don't think you should deny anybody. Now, their spectrum is how young should they be. I don't think anybody's matured enough for having breast surgery or a tummy or liposuction, and 18 and over on that. Now, don't forget, if you have a young kid that's 10 years old and being teased because they have lop ears and bullying, I've talked about that many times.
Right.
I think you have to have an exception to the rule there, and possibly make them feel like they're wanted in their classroom and amongst peers. So again, you can't categorize or generalize. You have to take each patient as an individual and see what's in their brain.
And that might even come into the question of the difference between cosmetic surgery and plastic surgery. So there's there's a difference there, right?
Yeah, well, I mean, there's cosmetic surgeons all over the world, and some of them aren't trained, and some of them, unfortunately, aren't board certified, and that's where we sometimes get a bad rep. Where a plastic and reconstructive surgeon under the American Society of Plastic Surgeons has gone through probably the most extensive training in I went 4 years of general surgery. I had 3 years of ear, nose, and throat. I had 2 years of plastic surgery, and so my training is extensive. There are guys out there that are doing what I'm doing after 1 year of residency. So they're cosmetic surgeons. I am a cosmetic surgeon, but I'm a plastic and reconstructive surgeon also. So it's like, if you're going to go to a cardiologist, a cardiovascular surgeon because you need a heart valve or something, you're going to want to go to somebody that's went to the most extensive training possible.
Right.
Dr. Nicoli, a lot of what you do is visual, it's artistic. What do you find inspiration in outside of the operating theater, outside of your practice, in terms of the artistic aspects of what you do? Are there particular pieces of art or practices, or even maybe you practice art yourself?
Well, I don't myself, because I body sculpture. I love the body when it comes to body sculpturing, and the face and the nose, and I think that's more my best artistic capabilities are. But I love going to museums. I've always, as a kid, I loved animals, and I would always collect the injured animal in the park, or the bird, and always try to nurture them back. And then finally, when I did that as a young age, I used to make furniture and stuff, and we built cars, and it was always the prettiest car on the block, and so beauty was always a concern to me.
Interesting.
So, but I learned that probably when I was about 15 that I really wanted to extend it into plastic surgery because of the war injuries and people having cleft lips and palates, and that's why early in my career I spent probably 20 years in third countries to do cleft lip, palates, burns, and congenital deformities.
Yes.
That's very honorable. I think that's really great.
You actually talked a little about the that new implant. Would you like me?
Let's talk about that. We
haven't
addressed that yet.
What are your thoughts on that?
Okay, now Allergan came out with a new implant in this country. Now it's been in the workplace by maybe 10 plastic surgeons throughout the country. It's been in Canada and Europe for at least 15 years. So it's not like it's a brand new implant. And here's the implant that you were talking about. It's the cohesive. It's the gummy bear implant. You cut this implant, and it's a solid implant. It's you can see the shape of it. It's shaped like a breast. It's textured, meaning a rough surface. It's not a smooth implant, and it's being pushed heavily by Allergan right now. It's been around before, and they're pushing it again. I think it's going to be a popular implant mainly because people want an implant that's going to last forever, and they want an implant that when it breaks, it's not going to migrate through the body. So it's, again, relatively new in this country. Is it going to catch on? We'll see. It's $1,000 more than just for the implant. More than the conventional implants. So we just went through a course, and we'll probably be using it to see how its popularity among surgeons in the United States are. But very popular in Canada, very popular in Europe.
I think it's pretty awesome. You didn't know we were going to ask that question, and you
No, I
have
did
one
not
sitting
know
right
you
on
were
your
gonna ask that
desk, and so you're up and coming, or up in the top ranks. That's for
And
sure.
I'm sure you didn't think I had that implant today.
That's exactly. That's really great, Dr. Nicoli.
What's the average? Just out of curiosity, what's the average lifetime of a breast surgery these days, depending upon what technology a woman chooses?
Well, as long as she doesn't have droopiness or other associated problems with the aging process. If she has small breast and she just puts silicone implants in there, they should last probably 25, 30 years.
Wow. Wow. Phenomenal.
And these, I mean, I don't know if you can see this, but I can twist this and twist. I mean, the durability of these implants today, and this one and the smooth implant are just phenomenal.
Yeah.
So
I'm experiencing pain from here.
Yeah, if your husband or boyfriend would do that to you, I think it's time to get rid of them anyway.
We would never do that to you guys.
So during your procedures, do you have any sort of particular habits or traditions that you follow? I'm sure patients are curious to know what goes on while they're lights out. Do you have anything that you want to share with?
In my operating room, we have, the patients are very well prepared prior to coming into surgery. But once they get to the surgery center, my staff treat them like they do in the front office. I mean, they're like queens. Mm-hmm. I mean, they'll bring them into the surgery center. The anesthesiologists who've been with me for 20 years, we've never lost a patient during surgery. So we've got a good track record, but they may pay a little extra, but they're going to have a top-notch anesthesiologist.
Yes.
The experience, they'll go through the operating room and they'll get an IV, and within seconds they're in Hawaii. Because I don't want to have them experience that smell in that operating room. And then the best of care. I mean, sterilized conditions. Our infection rate is so low that it's amazing. I mean, if you have a good team, you have a good operating room that's accredited, the patients should have a phenomenal result and a phenomenal experience, right. And very, very, very safe. People think, surgery should be done under local because it's safer. I disagree, because when it's under local, the surgeon is doing the anesthesia. When it's done under general, there's an anesthesiologist that's all he's doing is taking care of the lungs, the heart, and I'm focusing on my surgery. So I prefer an anesthesiologist there watching all of the vital signs while I'm doing my critical surgery.
Right.
Very interesting. Very interesting.
Dr. Nicole, we've taken up your time and so appreciate spending that time with you. And you've just given us some really great feedback. And I'm sure everybody watching this is going to learn a lot. You've answered a lot of great questions, and we really appreciate you.
Yeah, we'd be delighted to have you on a future program. And for everybody watching, if you like the program, look for future episodes at cosmeticnetworks.com or subscribe to our YouTube channel. Dr. Nicole, thank you very much for taking the time with us today.
Yeah. And if anybody would like to see us on our website, it's CosmeticCare.com. They can a lot of questions that can be answered, and I appreciate you having me on your show.
Thank you.
That's wonderful. Thank you very much.
Bye.